Associate needed in Virginia. Too many patients can cause problems. I'm here with Mario, amazing dentist, works with his wife in a practice, and they need an associate dentist to unlock more success, unlock more sanity, help more patients. So excited to be talking to you, Mario. So start out with, where's your practice and why are you guys looking for an associate?
Yeah, thanks for that introduction, Paul. So again, I'm Mario, and our practice is located in Harrisonburg, Virginia. And
And
so,
before I go to why, tell us, like, I do not have a working knowledge of the geography of Virginia. So give us like close to's or far, for, like a couple hours from, so our audience kind of knows where it is.
yeah, so we're only 2 hours from DC. We have James Madison University in town. If you're a college football fan, we just hosted College Game Day
Oh,
last week.
nice.
So we're on the national stage for that. And so, the people in the Valley are some of the nicest folks that we've ever had a chance to live with and take great care of. So it's an amazing place to be.
Awesome. So we got the where it is. Now tell us the why. Why are you looking for an associate to share in the joy of full contact arts and crafts on people who don't want to be there? That's dentistry, Mario.
Yeah, so it's a good problem to have, but our two dentists, Dr. Khanna and myself, our schedules are booked out now consistently for 4 months. And so we have lots of patients who have urgent needs, that we would love to have that opportunity, that capacity in our schedule to take care of more patients in a more timely fashion.
Awesome. So we got the where and the why. Now tell me the what. What procedures is this associate going to be doing most of the time? Share what their schedule look like. Crowns, fillings, extractions. Tell us about that.
Yeah, so I'll start by just kind of highlighting some of the technology that we have. So we have two CEREC mills. We have CEREC Prime Scan. We just got the CEREC Prime Print 3D scanner. We got a cone beam CT. We got ISO lights in every room, intraoral cameras in every room. So you're going to have all the technology that you need to do the highest
Nice.
level dentistry that you want to be doing. So things like same-day crowns, obviously direct composite restoration. We're doing full arch fixed prosthetics. We're doing digital dentures. Lots of exciting dentistry, Invisalign. If you're interested in extractions or pediatric dentistry, we have plenty of that as well. So yeah, it's really a high-tech practice. It's 100% fee for service. And so any of those procedures that interest you, we have those to offer to our patients.
I like that 100% fee for service. Dentists and doctors just have, that's how every other business runs. You just charge something and people pay it. But I've been in network for many years. We're currently totally out of network right now.
Nice.
I really enjoy that. So now talk about the compensation. How will you compensate this dentist? Let's say you're talking to yourself and you're trying to convince yourself to move to this practice, work there. You guys are a great team. But now tell this dentist how they'll be compensated.
Yeah, so we want everyone to feel 100% confident that during the onboarding process that they don't have to worry about finances. So you're going to have a $600 a day guarantee for those first 3 months, just so that you know that you can fill your schedule and have that built up. But Dr. Khanna and myself, we've had an associate in the past. We know what it takes. We've been through residency programs ourselves. So you have us here to ensure your success. But with compensation, there's no doubt in my mind, at a minimum, with a 100% fee for service office, if you can do 2 crowns and a couple of fillings in a day, you can average over $500 an hour of production. And so if we just do the math and look at the numbers, you're going to be making $1,200 a day. And so in a year, you can expect to make over $170,000, and that's working only 3 days a week with 4 weeks of vacation.
That's nice.
Hard to beat.
Dentistry, sometimes the joy in dentistry is dosage dependent, right?
Right.
And I think that's a great, there's many people who want a life like that, right? Where working 3 days a week, doing something else, they could be a parent, they could have other things going on. So we've talked about where's the job, why do you need an associate, what they're going to do, how they'll be compensated. But this is what I want to share, Mario. Dentists are people too. Not many people think of us as people, but we're people too, right? I always thought my teachers lived in the back of the classroom as a kid, and I think that people think we live in our operatories.
Right.
But let's talk to me outside the operatory. Hey, Mario, I'm going to come work with you and your wife. I'm just going to say, I'm 30 years old. I'm single. I'm going to move somewhere in the area. What can I do on the weekends for fun? What can I do outside the operatory for fun?
Yeah, so we have Shenandoah National Park right around the corner. So if you're someone that likes to be outside, even if it's just driving for incredible views, but if you're someone that loves hiking and being outdoors, there's tons of that stuff right nearby. It's a college town. So if you like the college town feel, we have James Madison University, as I said. So great sporting events right here locally. So if you're into that, we have that as well. if you like taking road trips and taking drives, I mean, you can get to DC in 2 hours, you can get to Richmond in 2 hours, you can get to Virginia Beach in 3.5 hours.
Nice.
So it's a great place to be. Yeah, being in the valley, just a beautiful place to live. You can have big house, a lot of land, short commute. So there's so many advantages of living in a town like Harrisonburg.
Also, well, this is an amazing position. You go to dentistjobconnect.com to apply to it. You can text VA to 215-798-9897. And I always wrap up with the 3 M's: morale, mentorship, and money. You talked about the money part, you talked about the morale and the mentorship, but just reinforce that. If someone comes and work with you, you and your wife will have their back. They can ask you questions. How often are you going to be on site? Kind of wrap us up with that.
Yeah, so we're here to support the third dentist that comes into our practice, however we need to ensure success. We have an amazing team. We're super protective of our culture. We have folks that have been with us for 5, 10, 12, 15 years. And so this is an amazing career opportunity. And I would encourage anyone that's excited to apply today, set up a meeting to talk with us, and we can explore how this fits with your career goals in the best way possible.
Awesome. Well, you are embodying our Dentist Job Connect Vibe of bonding dentists together. We're bonding dentists together, pun intended. More dentists working together, the better. So thanks so much for sharing with us, Mario.
Thank you so much for your time.